Welcome to this update, and the focus today is on vitamin D. Now, I've been meaning to get around to this for ages, but it involves quite a bit of prep, so I kind of put it off for a while, but I think it's important to do. And it is quite a complex video, to be fair. We're going to look at a fair bit of sort of science type stuff and fairly good quality evidence. But in case you don't want that, I'll give you the bottom line now. Now, I still consider that lack of vitamin D deficiency is a global pandemic and is predisposing people to a wide variety of conditions, infections, and making COVID-19 more likely to be symptomatic, possibly more likely to contract in the first place, and the person with vitamin D deficiency more likely to develop severe complications. And I think I'm going to present evidence to support that. Now, the bottom line, just still on the bottom line, 42% of the US population is vitamin D deficient. 82% of black people are vitamin D deficient. 70% of Hispanics are vitamin D deficient in the United States. The Scientific Advisory Committee on Nutrition in my country is saying take 400 international units a day. But the data I've found, for adults anyway, is giving, let me just get rid of me a minute, is suggesting these kind of amounts here. So rather than 400 units a day for adults, they're saying 1,500 to 2,000 units per day, with an upper limit of 10,000. So we see a big disparity between the official UK government recommendations and the recommendations I've got from what I believe is the scientific literature. So that's the bottom line. Still no one bouncing up about vitamin D. I believe people are getting sick and dying through lack of vitamin D deficiency. And the latest government guidelines, I mean, those Scientific Advisory Group of Nutrition, that was actually published, I think, on the 1st of July, round about then. It's only a few weeks old. So that's what this video is about. So if you want to stick around, of course, I'll be here, so you can stay if you want. Now, just to reinforce that, Scientific Advisory Committee on Nutrition, SACN, Vitamin D and Health Report. So they're saying a reference nutrient intake, RNI is what they're calling this, of 10 micrograms. Now 10 micrograms is 400 international units of vitamin D per day throughout the year for everyone in the general population age 4 and over. So 400 micrograms, so 400 units, 400 international units, or 10 micrograms is their recommendation. This reference nutritional intake were developed to ensure that the majority of people in the UK had enough vitamin D to protect against musculoskeletal health. Now, this to me is probably the big problem. Of course, we've known for, well, I don't know, I've always known, I think people have known for well over 100 years, probably more than that vitamin D is essential for bone health. And the levels that people require very often have been enough to prevent rickets and the problems with bone health that vitamin D deficiency causes, but not taking into account all the other things that we now know vitamin D does. So it could well be, as this group says, that this range is fine for making sure children don't get bendy legs and rickets. But does it account for all the other things that we now know that vitamin D does, is the question. And this to me was a inexplicable. Scientific Advisory Committee on Nutrition did not take account of sunlight exposure. Now, all the reading I've done indicates that 90% of the vitamin D that we have comes from sunlight, but they didn't take account of that in making recommendations because of the number and complexity of factors that affect skin synthesis of vitamin D. Let me paraphrase that. They didn't want to point out that some people were black and some people were white and some people were brownish. That appears to be what they didn't want to point out. Might be wrong, but that's what it seems to me. Because the darker the coloured skin, the more slowly the vitamin D is produced, of course. And the reason I bring this up is because it can save people's lives, I believe. Now, vitamin D, this is just another paper. Evaluation, treatment and prevention of vitamin D deficiency, the Endocrine Society. Clinical Practice Guidelines 2011. Now, the Endocrine Society, that's the national society where all the endocrinologists and people that are interested in this hang out. And to be quite honest, if these guys don't know, then no one does. These are the definitive opinions on this matter. And they also published in the Journal of Endocrinology. And this was published in that article. So that's their website there. Check it out. This is this journal article I'm about to briefly refer to now. Now, they say vitamin D deficiency is very common in all age groups. Simple statement. Simple statement. Very common. Few foods contain vitamin D. Most of it comes from the sunlight. Remember, these guys didn't want to consider that. Didn't want to consider it. Few foods contain vitamin D. Some oily foods do, oily fish for example, but again not massive amounts typically compared to the amount that we eat overall. Task force recommends supplementation depending on age and clinical circumstances. Now, this task force was not paid. They were not paid by anyone or anything. They just did it because they wanted to do it. So supplements are required depending on clinical circumstances. Measurement of serum vitamin D, hydroxy vitamin D levels. Now, that is the active form of vitamin D in the blood, the active form. So that's what should be measured. It should be measured in patients at risk for deficiency. Don't really see that being done very much. Treatment with supplements for deficient patients. So in other words, people should have the blood levels checked. And if the blood levels are low, a supplement should be given according to that paper. Just to remind ourselves of the situation, this is the United States. 42% of the population is deficient in vitamin D. 82% in black people, 70% in Hispanics. So really quite significant amounts of vitamin D deficiency there. Just kind of let those figures soak in a bit. These lives all matter. Now, the main thrust of today's report is this paper. Published in the journal Nutrients, 15th of July 2020. Bang up to date. Prestigious journal. Immunological effects of vitamin D on human health and disease. So, of course, calcium and phosphate metabolism for healthy bones, for a healthy skeletal system, we know that. 125 dihydroxyvitamin D is the active form of the vitamin in the blood. Actually, what happens when it's made in the skin or you eat it, it goes to the kidneys and places like that where it's slightly modified into this active form. That's why it's sometimes called a hormone, because it's actually produced mostly by the kidneys. It's excreted by the kidneys and it goes around the body and has a systemic effects on other targets. So you could argue, well, it is a hormone really. So the vitamin D that's made in the skin and the diet is converted into the active form. This is why people who have renal disease can often get bony demineralization and other problems, because they don't, the kidneys don't synthesize the active form of vitamin D. It's an immunomodulator. It modulates, it changes the nature of the immune system, and it affects the innate and the adaptive immune systems. So the innate immune systems, you might remember, work against a wide variety of potential foreign organisms. The adaptive immune system generates a specific immune response, such as antibody production. And there's vitamin D receptors and enzymes in lymphocytes, these essential white blood cells that fight viral infection. Now, lymphocytes are divided into big and small lymphocytes. These are the big ones. And the NK stands for natural killer cells. These NKs, the natural killer lymphocytes, will kill virally infected cells, therefore preventing the virus from spreading onto other parts of the body and other tissues. T lymphocytes control the B lymphocytes. The B lymphocytes produce the antibodies. Monocytes are other big white blood cells that can differentiate into the white cells that are often present in the tissues, the macrophages, and the dendritic cells, which are called antigen presenting cells, which actually initially detect the presence of foreign viruses and bacteria, also differentiated from monocytes. So in other words, a whole range of immune cells is what we're trying to say here without getting bogged down. Also, vitamin D affects the vascular endothelial membrane stability, and of course we know that there are problems of disseminated intravascular microthrombi formation in COVID-19 complicated disease. So a few things fitting together there already. Now, association with low blood levels of active vitamin D. These are immune related diseases. Now, what you've got to realise about the immune system is that the immune system is what protects us against foreign material, of course, foreign organisms, bacteria, viruses, all that kind of thing. But when the immune system goes wrong, in some pathological conditions, we get what we call autoimmune conditions, where the immune system starts beating up on the body's own tissues and damaging the body's own tissues. Now, this is a mistake. It's not supposed to happen. It's pathological. In military terms, the tissues are damaged by friendly fire. So the immune system that's supposed to beat up on the viruses and bacteria makes some mistakes and starts beating up the body's own tissues. That is autoimmune disease. And the idea is that vitamin D is immunomodulatory. So it turns up the immune system when we need to go kill these bad guys, these viruses and these bacteria. But it turns down the immune system to stop it beating up on our own tissues and damaging our own body tissues. It's immunomodulatory, getting that balance right. And that explains why there's associations with low vitamin D levels and increased problems with psoriasis on the skin, that scaly skin, type 1 diabetes, very often at a young age, the insulin-dependent form, multiple sclerosis causing paralysis, rheumatoid arthritis causing unbelievably painful joints, tuberculosis can cause long-term bacterial infection, sepsis is the body's cytokine storm in response to infections, and respiratory infections, and COVID-19. So all of these things are associated with low levels of vitamin D. And as you can see there, some are caused by not enough immunity, not beating up the viruses and bacteria. Others of those conditions are caused by too much immunity in the wrong places, beating up on the body's own tissues. So we have this lack of modulatory effect in the lack of vitamin D. Now, practically, what are the optimum levels? Optimum 25 hydroxyvitamin D levels. What do we want to achieve? Notice we're saying what's the optimum level. We're not saying what is the minimum level required to stop children getting bendy legs in rickets. We're saying what is the optimum level for overall health. And this paper is saying it's advisable to increase vitamin D intake and have sensible sunlight exposure. Unlike this lot, who didn't want to think about that. The Scientific Advisory Committee on Nutrition didn't want to think about it. This fairly definitive paper is saying it's exactly what you should be thinking about. There's a clear contradiction here in my mind. To maintain, now, the key thing is, people are always saying, how much vitamin D do I take? Now, the first thing is, I don't prescribe. Your own doctor prescribes. So you have to ask him that. As I've told you many times, I'm taking 2,000 units a day, which is 50 micrograms. But the point is, different people are going to respond in different ways to different doses. So the only way to know that you're getting the right amount is to check the level of vitamin D in the blood. So, you know, Joan could take a certain amount of vitamin D and get a certain blood level, whereas Harry could take more vitamin D and not get as high a blood level. There's an individual response here. So the way to titrate this ideally is to do blood tests, and basically we're virtually never doing it. It just doesn't seem to be happening. So the ideal is that you maintain serum blood levels of 25 hydroxyvitamin D of at least. Now it gets it's a bit confusing here as well, because that's the American way of measuring it and that's the English way of measuring it. So 30 nanograms per mil is 75 nanomoles per litre. In other words, that equals that, it's the same. So that is what you want at least. This paper is saying that is the minimum. And preferably 40 to 60 nanograms per mil, which is 100 to 150 nanomoles per litre. So that's the answer. They're saying that that is the minimum, that is the preferred. But the only way you're going to know that is if your doctor orders a blood test for you. So recommended doses for vitamin D intake and individuals who are at risk for vitamin D deficiency. So remember the UK government, this advisory committee said 400 units, which equals 10 micrograms, is what they're recommending. But let's look at what this paper recommends. Depends on the age. So they're saying 0 to 1 year, 400 to 1,000 units. 1 to 18, they're recommending 600 to 1,000 units. Uh, 18 plus, 1,500 to 2,000. People with obesity or malabsorption, 4,000 to 6,000. That's compared to the universal committee recommendation from the UK of 400 units, which is 10 micrograms. Bit of a difference, clearly a difference. Now this paper in Nutrients is saying the upper limit for that age is 2,000, 4,000, 10,000, 10,000. So that's giving the upper limits there. So we see there is a clear discrepancy between these recommendations and the UK Scientific Advisory Committee on Nutrition recommendations. Now this paper from Nutrients goes on to say, and of course, if you want to go into this, go into this paper. There's I don't know. I think there was about 200 references on it. It's a very definitive paper. It's not just two guys waffling on. And these are their guidelines for treating deficiency. So that's for 0 to 1 year olds. That's their guidelines for that. Now, don't copy these, of course. I might have copied them down wrong. Go to the paper, look it up for yourself. Take your child to your own doctor and get the proper amount. 1 to 18 year olds, 2,000 units a day or 50,000 units a week of vitamin D2 or vitamin D3 for at least 6 weeks. 6 weeks, huge. So that's saying like 2,000 units a day, not 400 units a day. But the point always is to achieve this minimum level, 30 nanograms a mil, 75 nanomoles a litre. That's always what we need to achieve. And again here, that's what we're trying to achieve. Then it gives the maintenance therapy. And again, for deficiency after the age of 18, to treat deficiency, 6,000 units a day or 50,000 units a week to treat deficiency. And of course we know that many are deficient. Where's my deficiency figures? What Americans, there we go, the amount that are deficient. In the United States, 42% of the overall population, 82% of the black population and 70% of the Hispanic population in the United States are deficient. So many people deficient. Then it gives maintenance therapy again. Obese and malabsorption patients, the dose should be increased by 2 to 3 times. So malabsorption means that the gut is not absorbing the vitamin D, or people that are obese. And because this is a fat-soluble vitamin, in people that are obese, what happens is when they take the vitamin, it goes into the gut, of course, but then it goes mostly into the fatty tissue. And the fatty tissue fills up before it gets into the blood. So they're the kind of doses they're talking about. Go to your doctor and see what he wants to give you. Clearly, if you're Hispanic or black and you live in the United States, I would advise that you take advice on supplements now, because you are in a very high risk group to be deficient. Right, respiratory viral infections and COVID-19 and lack of vitamin D. Now, outbreak of influenza infection is periodic and usually occurs in the winter time at higher latitudes. And of course, winter time is higher latitudes. If you live in Canada or Chicago or the north of England like I do, then you're not going to make as much that time of year. So we get more influenza when our vitamin D levels are lower. And we know from population studies that the levels of vitamin D are higher in the UK in the summer, lower in winter time. But in tropical areas where there's plenty of sun, it's sporadic. You can get it any time of year. Association between low levels of vitamin D and increased severity of respiratory tract infections in children and adults. So increasing incidence of respiratory tract infections, and they are more serious. And we've looked at many papers on this channel already that describe that. But just to give one example, a recent meta-analysis of 25 randomised controlled trials showed that supplementation of vitamin D2 or 3 can protect against the development of acute respiratory infections compared with placebo. And we have done this paper in detail. The link is there. So this is based on good trial data. Now, when it comes to COVID, of course, the clinical trials haven't been done. So do I know that vitamin D is going to protect against COVID-19? Absolutely not. Absolutely not, because the trials have not been done. But given everything else we know about it, I'd be amazed if it didn't. If it turns out that people with low levels of vitamin D aren't more predisposed to getting COVID-19 and getting complications from COVID-19, I would be very surprised, given everything else that we know. Now, groups that are particularly at risk: African Americans, Hispanics, as we saw, and people with obesity. And we know that these are, we were just talking about obesity, was it yesterday or the day before? Significant comorbidity. African Americans, we know, have had an appalling rate of morbidity, and of course these lives all matter. We can't ignore this. Worldwide, on average, approximately 40% of children and adults have circulating levels below 20 nanograms. So globally, 40%, much the same as the United States, really, the global position. About 40% of people are deficient. And this pandemic is going to probably affect potentially 70% of people in the world. So this is just massive. 40% of the world's population is deficient in vitamin D. Let that sink in. It's a pandemic of vitamin D deficiency. And this paper in Nutrients said it's therefore reasonable to institute a standard of care to give at least one single dose of 50,000 units of vitamin D to all COVID patients as soon as possible after being hospitalised. That's what they're saying. I'm not going to disagree with it. But I would say that prevention is better than cure. Personally, I'd prefer to take a vitamin D supplement before I got ill to hopefully prevent severe COVID-19 disease than to take it after I got ill, because I prefer not to get ill in the first place, to be quite honest. And suspect you're the same. Now, just to finish, because I know I've thrown a heck of a lot of stuff at you today. And I'm aware I've gone quite fast as well, so if you want to watch this twice, do feel free. Now, this is, I find this really potent, actually. You see, why am I white? I believe the reason I'm white is because my skin makes vitamin D more quickly. That's how important it was. Of course, we're all Africans. We all come from Africa or wherever, the Middle East. We've all migrated round there from around the world. The original humans were black. Now, if you believe in a literal Adam and Eve, I believe that the literal Adam and Eve were black. If you believe in human evolutionary theory, then clearly people in Africa were black. So the original humans, whatever you believe, were black. So why did my ancestors turn white as we migrated north? So we could make more vitamin D more quickly. It's just an overpowering argument to my mind. We have a whole group of people in this world that aren't black, that are white, purely because they can make vitamin D more quickly. and a few other photochemical effects on the skin as well. That's why we're white. Now, learning from others. So this paper says our hunter-gatherer forefathers. So in other words, when we were hunters and gatherers before we had agriculture, like I suppose agriculture started. When did agriculture start? Anyway, let's say agriculture started about 14,000 years ago, 8 to 14,000 years ago at the start of the Neolithic. Anyway, before that, our hunter-gatherer forefathers likely maintained serum vitamin D levels in the range of 10 to 50 nanograms per mil, or 25 to 125 nanomoles per litre, because they were outside hunting and gathering, as the name hunter-gatherers would indicate. Now, evidence for this: Maasai herders. Maasai, for example, in Kenya, Hadaz tribesmen in, I think this group's largely in Tanzania. Studies have been done on these people. So the Maasai and the Hadaz, they spend a lot of time outside looking after cattle. They're basically outside all the time. And they maintain active vitamin D levels in the blood of 40 to 60 nanograms, or 100 to 150 nanomoles per litre. Very high levels. And of course, both these people groups are black. They both have very dark, the Hadaz especially have very dark coloured skin. And we know that dark coloured skin makes vitamin D way more slowly than white coloured skin. Yet because they're outside all day in the African sun, they make good levels. It's only when people migrated out of Africa that we had to turn white to make more vitamin D up in these rarefied, poorly sunlit northern and indeed southern latitudes. So I thought that's really very important piece of research there. You know, these black people groups working outside and maintaining these high levels in the indigenous environment of Africa. To maintain these blood levels, interestingly, approximately 4,000 to 6,000 international units are required if you are inside all the time. So I was talking to my friends in India, and some of you might have done an interview on this, I can't remember. Anyway, I was talking to some friends in India, for example, and I said, look, you guys need to get your shirts off and go outside and get a little bit of sun sometimes. You get plenty of sun in India. But in India, culturally, Indians don't do that. It's not their culture to go in the sun. So quite a few of my friends there have been taking extra vitamin D. It's just not their culture to go in the sun. They just don't do that. That's for mad dogs and Englishmen who go out in the midday sun. So, and of course, a lot of people in India now anyway are working in call centres and indoor work, as we do in the UK. A lot of it's indoor work. So we're just not getting these levels. So if you're not getting these levels, these authors suggest in this paper, that's the kind of levels you're talking about. So that's a minimum of 10 times higher than is recommended by the Scientific Advisory Committee on Nutrition. Don't take my word for it. Go and read the paper. This is all there. This would therefore maintain circulating levels of vitamin D in the range of 20 to 40 nanograms, which is nearer the level maintained by the Maasai and the Hadaz in Africa. And then the authors conclude, the bottom line is there is no downside to increasing our intake of vitamin D to maintain serum levels of at least 30 nanograms per mil, which is 75 nanomoles per litre, and preferably higher, 40 to 60 nanograms per mil, 100 to 150 nanomoles per litre, to achieve optimum overall health benefits of vitamin D. So that is the current state of the literature as I understand it. Now, what I can't understand is why I can read this literature and see these obvious things in it, but the Scientific Advisory Committee on Nutrition presumably has access to the same literature. Although now this paper's published in Nutrients, which is only published on the 15th of July, maybe they'll update their guidelines. Let's wait and see. But I feel my main duty today is to point out to you there is a discrepancy between these guidelines and what I perceive the literature to be saying. And the reason I'm doing this, the reason I spent all day prepping this, is not because I like, well, it's just what I do, but it's not because I would prefer to be digging the allotment or something, but because I realised that this information is there's 40% of the world's population are lacking in vitamin D, and we have a pandemic of an infectious disease, and I feel it's got the potential to make a difference. So go along to your own doctor, ask for a vitamin D assessment, especially if you're in these high risk categories. Would be the minimum thing I would currently suggest.